Hey everyone, Dr. Hales and Dr. Parker here from Hales Parker Dentistry. And today we are concluding our series of our dental emergencies. But if you have any other questions, just comment below and we'll add some more videos for you. So what we want to talk about is kids' emergencies. And what that can focus on is we all have kids. I have three kids and they are crazy, always running around, jumping on the bed, right? And how many times do they fall or hit themselves? Probably at least 5 times a day. And we often get phone calls of, hey, my kid just hit his tooth or my kid is in pain. So we want to go over some of those options of what to do in these situations instead of just rushing straight to the dentist, or at least giving them information of what you got.
Yeah, many times these are the scariest phone calls because as a parent, you know, your little kid, they have a hard time communicating to you, so that induces a lot of fear and anxiety in the parent that they want to make sure that their kid's well taken care of. So when these situations arise, first and foremost, obviously, is make sure your kid's okay, because teeth are secondary to the kid being all right. And so if there's greater injuries or whatever, head trauma, those types of things, obviously take care of that first. But if it seems to be a tooth trauma only issue at this point, good news is kids' teeth, baby teeth, are really meant to take a lot of this trauma. Baby teeth, they're evolutionary designed to be beat up because these kids are not as coordinated as a grown-up. So if first thing you want to assess is the tooth in the right position? Okay, so as they've fallen or gotten hit, is that tooth knocked into a different position? If it's still in the mouth and in a different position, if you're feeling brave enough, just pop it right back into the position it's supposed to be in as soon as you can. Just line it back up. Trust me, you'll do a good job at this. You've seen your kid a lot, so you know where that tooth's supposed to be, so you can handle that just fine. If you're too nervous to do that, we're happy to do that for you at the dental office. But the sooner you can do that, the better, and the quicker things are going to heal appropriately. Second thing is, if it's not in the wrong spot, but it's a little bit wiggly, okay, that's good for us to know, but really not too big of a deal and not too much that you have to worry about, because if it's a little bit wiggly, it's gonna tighten back up, and that tooth's gonna be just fine, and most likely doesn't need a visit with the dental office. Now, if the tooth is chipped or broken, we got to start assessing some other things. And so a lot of times what you'll notice is there's bleeding around the gum line. That's also not a big deal, and that's a normal trauma response. But if the tooth's broken, several things that we need to look out for, and is that tooth sensitive, or is the tooth bleeding from the center of it? Because if the tooth's bleeding from the middle of the tooth but not the gum line, that's a different problem to solve. But if the tooth's broken, not a big deal, we can fix that, not really an emergency, and something can be handled, comfortably at the right time. From there, typically that's gonna cover most traumatic tooth injuries on kids. And so, like I said, they're meant to take that beating, those baby teeth, and so not a big deal. If it's a permanent tooth, you can refer to our other videos on tooth trauma, and it's the same stuff. Now, sometimes kids will have pain in their teeth, and so they'll wake up one morning and say they've got a sore tooth. If a kid's complaining of a sore tooth, that typically means that tooth has a relatively large problem, because kids' teeth, for some reason, they're just not as sensitive. And so cavities need to get to a pretty big size for it to become painful. If that's the case, what you want to look out for is, can you visually see the cavity? Have them open up, tilt their head back. Can you see a hole in the tooth? This will help you communicate to the dental office better. You can grab a picture of it, that will help also. The other thing to look out for is there any bumps on the gums above the tooth or below the tooth that's on the bottom? So you've got your gum line. Is that bump separated from the gum line where like the roots of the teeth are going to be? That's important for the dentist to know in addressing that situation. If those are the cases, obviously you need to get to the dentist as soon as possible to relieve the pain for the child and also fix the tooth. Sometimes a baby tooth can't be fixed, and we pop it out, and there's different things we do to make sure the jaw develops appropriately. But rest assured, if you can analyze these different things and then reach out to the dental office, or when you show up, you can give them this information, your child's going to be much more better taken care of, and you're going to be in better shape. So we want you to be more informed so you can take better care of your kid, but also achieve better health outcomes with your dentist, because really we're passionate about our patients being in control and feeling like they're having good health outcomes with their teeth. So anything else you can think of, Dr. Hales, on kids' trauma?
Not really. Kids' teeth are different than adults' teeth and how you kind of approach it, because like you said, they're different. And so, don't worry about so much if they're chipped or broken, things like that, because baby teeth are meant to fall out and the permanent ones are meant to come in. So we always want to make sure that we're protecting those permanent teeth, because those are going to last a lot longer. If any questions, just follow up with us. But you guys can be the professionals at home and let us know how it goes.
Thanks.